Hi, welcome to HASA's Virtual Health Record Training. This video is a brief overview of the ADT Lab Radiology and Transcriptions tab. The ADT Lab Radiology Transcription tab is a summary page that includes the last 10 records within a date range for encounters, labs, radiology reports, and transcribed reports. At the top, you'll see the patient's name, date of birth, age, and gender. Below that, you have a row of buttons. The refresh button, you can click and it will refresh since the last time you opened that patient's record. The filter button is where you can change the date range, filter by facility, and provider. You can also search for a specific record. The default date range is 90 days. Since we don't see much information on this patient, we'll change the date range. You can do so by clicking this calendar button, by typing in the date, or by clicking the drop-down. We want to go back 2 years, and then click Filter. Now you can see we have more information for this patient. To hide this filter bar, click the Filter button again. The filter that you select applies only to this tab, and when you click to other tabs, you'll need to change the filter to whatever you'd like it to be. This tab and the next 4 has 2 modes: View Records and Select to Print. In the View Records mode, you can open records for details and view them. In the Select to Print mode, you can select specific records that you would like to print or save for upload into your EHR. To do this, you'll click the check boxes next to those records which you would like to print. As you select them, you'll see the number of records you've selected on the print icon, and you can click that icon to view your print selections. If you want to preview the record that you've selected to print, click this magnifying glass, and it will show you what you will be printing. If you decide you don't want to print that specific record, you can click Remove from List here, or the minus button to the right reports title. Once you've selected everything you'd like to print, you can click the Print button. We're going to go back to the View Records mode. For each of the sections below, clicking on the section's title will take you to that specific tab. To view individual entries, select the row you'd like to look at. For encounters, it will display the ADT information along with allergies, diagnosis and problem, and the medical insurance history for that specific entry. If you see something you would like to print, you can click the Print button, or you can add it to the list of print selections. For any entry, you can scroll down and click the Original Document checkbox to view the information in the way it was sent. Just like in other tabs, you can click the column title to change the order they're displayed in. If we had lab results listed here, this column identifies abnormal indications and will show a red warning sign if the sending location flagged it as an abnormal result. For radiology, You can click on each line for more details, but keep in mind that we do not receive images, only the documents attached with that radiology report. When you click the original document box, you'll see the information as we were sent, along with the reason for exam, findings, impressions, and the ordering provider. Make sure you check the original document because sometimes ordering provider is sent as free text instead of as HL7, and so it's not listed up here in the ordered by section. In transcribed reports, you can click each individual record for more information. And when you click the original document, you'll see information such as the exam name, the technique, findings, impressions, and the provider or care team. The recent records drop-down in the top right will show you what you've looked at recently, and you can click on it to reopen that document. Thank you for watching this video, and be sure to look on our website for more training videos on all of our products.